So let's discuss introduction to anatomical terms, organization of human body. So here we can see that in introduction part, the human body is rather like a highly technical and sophisticated machine. The human body is compared with the highly technical and complicated machine. So a human body it work as a complex machine, so it operates as a single entity but they made up of a number of systems that work interdependently. That means the human body, this is one single person or a single human being, but this human being is made up of number of systems so that are dependent to each other. So, should one system fail, the consequence can extend to others and may reduce the ability of the body to function normally. So, there are 11 systems that make the human body. So, if one system has not functioning properly or the one function is totally failed to function, so it may affect the others function also. Okay, let's go to the next slide. So here we can see the term of anatomy. So anatomy is the study of structure or body part and their relationship to one another. So anatomy is the like study where we are studying the structure and body part of the human body and their relationship to one another. Next, that is Aristotle was the first person to use the term anatom. So that means the anatom is came from the word anatomy word is came from the word anatom, which is a Greek word. The meaning of anatom is cutting off or it taking apart. Next, as that point is anatomy is one of the oldest basic medical science. So among the all the medical science, anatomy is considered one of the oldest medical science, and human was taught in Greece by Hippocrates in between 460 to 377 before Christ, is regarded as the father of medicine. So the human medical science has already taught in during these years, and Hippocrates is also considered the father of medicine. In the next slide we can see that the physiology. So physiology is a study of how the body system work and the ways in which their integrated activities maintain life and health of an individual. So here in anatomy part we are studying the structure and uh, organs and their relationship to another organ. So here in the physiology part we are going to study that organ, that system, how they work, and that as a whole how they are maintaining the health and life of the individual. uh, Next, that is subdivision of anatomy. The anatomy has divided in many division. So here the first one, that is gross anatomy. The gross anatomy means study of structure of human body, usually with naked eyes. Here that without cutting, without using any microscope and all, if we study the human body with naked eyes, that is called gross anatomy. Number two, that is systemic anatomy, study of the human body system. Example, digestive system. So we have 11 system in our body. So if we study each of the system or separately or together, that will be called systematic anatomy. Number three, regional anatomy, study of structure and organization of a definitive part of the body. Uh, that means if we study the structure of any like body part, like the various part of reason are as follows. Like if we study the structure of any body part like neck, thorax, abdomen, head, that will be called regional anatomy. Number four, Functional anatomy, study of anatomy which provide correlation between the structure and function of various organs. And like in functional anatomy, mainly we are going to study how the like mainly is going to study the function, like organ, how they function, in the function of various organ and their relation to one organ function relation to the another organ function. In next, number 5, that is developmental anatomy, study of parental, it will be parental prenatal and postnatal development changes of the human being. So normally human body's development is start before birth, that means uh, 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 during the pregnancy period, so that will be called prenatal. Then after the birth, that is called postnatal. So development will be start from pregnancy period and it will continue till we can call till 21 or when they will become adult. Number 6, histology and cytology, study of various body structure, organ, tissue and cells in greater details with the help of microscope. So to find out the abnormality, to find out the difference between the healthy cell and unhealthy cell, the healthy tissue and unhealthy tissue. So like for that one we need to take the help of microscope, so we can by using the microscope we can identify the abnormality, that will be called histology and cytology. Number 7, surface anatomy, the study of external feature of the body. Like it deals with anatomical feature that can be studied by sight without dissection. That means without dissection, without cutting, if we study the external feature of the body, that will be called surface anatomy. Number 8, clinical anatomy, the practical application of anatomical knowledge to diagnose and treatment. So till now what we have studied in anatomy part, that will be mainly that the healthy and unhealthy anatomy part. In clinical anatomy we have to find out the like whatever we have studied the normal structure and function, like here main focus will be on the diagnosis and treatment, how we have to diagnose the abnormality or the any disease, and after diagnosing we have to do the treatment part, that will be called clinical anatomy. Number 9, that is comparative anatomy, the study of structure variation between other animal and human being. In some cases we have to compare our human body and other mammals means like who have birth uh, through reproductive way. Mm, so here the reason is like whenever the scientist has find out any a type of innovative vaccine or the medicine, they apply that medicine or the vaccine on the mammals, so it can by researching that part we can use that one in the future, in the future we can apply on the human.